Damon Wilson, Executive Vice President at the Atlantic Council. And for those of you who are joining us virtually from Taiwan and across Asia, thank you for tuning in this evening for today's discussion, which is being hosted by our Asia Security Initiative, part of the Scowcroft Center for Strategy and Security. It's 9 a.m. in Washington, 9 p.m. in Taipei. Today, we are honored to be hosting Taiwan's Digital Minister, Audrey Tang, for an inside look at her government's internationally lauded response to COVID-19. Minister Tang, welcome back to the Atlantic Council.
Hello, very happy to be virtually here, and good local time, everyone.
Thank you so much. We're looking at striking data behind Taiwan's coronavirus response, and one number has jumped out to me in particular: 81. At its closest point, Taiwan is just 81 miles from China. Yet, despite being on the literal front lines of the early outbreak, Taiwan has managed to keep its number of domestic cases below 500. Swift, coordinated measures taken by Taiwan's government, despite not being part of the World Health Organization, have made the island one of the greatest success stories of this global pandemic. And we're eager to hear more from Minister Tang about her lessons learned in the battle against COVID-19. It also strikes me that the importance of Taiwan's success story goes beyond the critical public health lessons that it provides. At a time when authoritarian regimes around the world point to outbreaks in the United States and Europe as false evidence of democracy's fundamental weaknesses, Taiwan has demonstrated how democracies can leverage core strengths, including transparency and public trust, to provide international aid and coordinate an effective global response alongside the US and its democratic allies and partners. To date, Taiwan has donated millions of masks to parts of the world hit hardest by COVID-19. And Taiwanese research institutions continue to partner on the development of new tests and treatments for the virus. So here at the Atlantic Council, we recognize that securing the post-COVID-19 world isn't about getting back to where we were before the pandemic. Instead, we're working to identify, understand, and amplify the kinds of innovative measures we've seen in places like Taiwan that will help the United States and its allies and partners move forward to a rules-based international order that is more resilient and coordinated than before. So to that end, we're especially excited to be hosting Minister Tang, who has played a key role in Taiwan's effort to leverage information technology and digital democracy to launch innovative apps, platforms, and policies in the fight against COVID-19. The minister has been a guest of our Asia Initiative, our Cyber Statecraft Initiative, our Digital Forensics Research Lab programs in the past, and we're delighted to have you join us again, this time virtually. Since joining the Executive Yuan in August of 2016 as Digital Minister, Minister Tang has spearheaded Taiwan's efforts to increase public participation and policy making through digital platforms, and has overseen measures to spur the growth of tech startups. Prior to joining the Taiwanese government, Minister Tang has been a prominent member of the online collective Gov, a group of digital activists that sought to introduce internet governance and bring transparency to the Taiwanese government's work. Her activism has seen her serve as a consultant to the Taiwanese government's Project V Taiwan, a digital platform that invites citizens to participate in policymaking. A self-taught programmer, she dropped out of school at the age of 14 and started her own IT company at the age of 19. She also served as an advisor to Apple's projects on artificial intelligence, spending significant time in Silicon Valley. So thank you again for joining us this morning in Washington, this evening in Taipei. And with that, I'd like to turn things over to today's moderator, Amy Mackinnon. Is a staff writer at Foreign Policy and host of Foreign Policy's weekly coronavirus podcast, which is called Don't Touch Your Face, one of the best names in the podcast industry out there. Amy, we're delighted to have you as moderator for today's discussion. I also just want to give a shout out to our team, to Mian Oh, Barry Pavel, and James Hildebrand for making today possible. Amy, over to you.
Thank you very much for that introduction, Damon. And I am so excited to be here. I feel like on the podcast, and every day, like a lot of us, I just feel like I'm reading about everything that has gone wrong with the coronavirus response around the world. And, it just feels like bad news after bad news. So I'm very excited to get the opportunity to spotlight a good news story in the fight against coronavirus for a change. And as you mentioned in your opening remarks there, given Taiwan's proximity to China and the high amount of travel between the two countries, researchers at Johns Hopkins had initially estimated that Taiwan would have the second most amount of cases of COVID-19 in the world outside of mainland China. And clearly, that's not the case. In fact, Taiwan is now one of the global success stories when it comes to their coronavirus response, proving that early intervention, smart and innovative leadership, and steps that they took early on in the outbreak were able to produce a markedly different outcome. And now, as countries in Europe and states across the United States look to reopen their economies, I think there is a lot that we can learn from Taiwan's experience. So without further ado, actually, before I will dive into questions, I just want to flag that we're taking questions from the audience as well. So you can submit your questions via Twitter using the handle @ACScowcroft or in the comments section of the Facebook and YouTube live streams, wherever you may be watching. So without further ado, I shall turn to Minister Tang. Thank you so much for joining us. Just to kick us off, can you just give us an overview of where things stand now in Taiwan?
Yes, very happy to be joining all of you. And currently, Taiwan feels calm. And also, there's recently a case where we introduced a app that allows people to pre-order a rationed mask. But for people who have not collected their rationed mask, which is 9 medical masks every 2 weeks if you're an adult, and 10 if you're a child, you can choose to dedicate the ones you have not collected to international community in need. And in just 2 days, there's more than 2 million face masks dedicated by Taiwanese citizens in just a couple of days since we launched this feature. And so this shows that it's been 100 days since we launched the Central Epidemic Command Center, or the CECC. For 16 consecutive days, there's no local cases confirmed. So we are now in the stage where people are feeling generous.
Wow, that's incredible. And congratulations. We feel a long way off from that moment here in Washington, D.C. So before we talk about the current coronavirus outbreak, I want to talk about a previous coronavirus. How did the SARS outbreak of 2003 lay the foundations for Taiwan's response to this outbreak?
That's an excellent question. So ever since the 2003 SARS epidemic, we've been reviewing the things that we did not do well. For example, there were no Central Epidemic Command Center that I just mentioned. There was very confusing. What does the local municipalities do? What do the national government do? The chain of command is very much chaotic back in the SARS days. I think everybody in Taiwan who are above 30 years old remembers how chaotic it was. And we decided that 37 people died for that. Is 37 people too many? And there was a particularly traumatic episode where we had to basically barricade an entire hospital without any warning or about the extension of time of which they will be barricaded and so on. And so because of this, I would say it's almost like an inoculation. The whole society mobilized at this time because we've been constantly practicing as a society, not just from the government, what to do if SARS happened again. So when last year, the last day of last year, last December, when Dr. Li Wenliang, the PRC whistleblower, posted that there are new SARS cases on the social media in the PRC, whereas many jurisdictions began countering and taking that into notice only this year. We started last year because our local equivalent of Reddit, the PTT board, has somebody reposting that, and the head of CDC immediately noted this post and issued an order that says all passengers flying from Wuhan to Taiwan need to start health inspection the very next day. That is the first day of 2020. So that's as if SARS has happened all over again. We've been practicing that for the past 17 years.
Mm-hmm. Could you just tell that story of how, because I just think it's fascinating how the local version of effectively Reddit played this huge role in triggering this fantastic response. Just walk me through, what happened on that evening of December 31st in Taiwan.
Yeah, sure. So it's actually very early morning in December 31st. There was, it's about the same hour actually that Dr. Li Wenliang would be questioned by his institution. And a few days later, he would be basically punished by the local police station. But what happened in Taiwan is that the head of CDC immediately noticed the post, which is by someone with the nickname No More Pipe. And it includes the full Li Wenliang whistleblowing account. Mm-hmm. And so this, to me, says two things. First, the civil society trusts the government enough to talk about possible new SARS outbreaks in the public forum. And the second is that the government trusts the citizen enough to take it seriously and treat it as if SARS has happened over again, something we've always been preparing since 2003. And so because of this open civil society, according to the Civic Taiwan is the most open society in the whole of Asia, we emphasize on opening our mind to new novel ideas, so it serves as a advanced collective intelligence warning system.
Mm-hmm. And so where did things go from there? I mean, you got winds that there was this kind of possibly another SARS outbreak or this new pneumonia spreading it in Wuhan. What were the next steps which the government took?
Right. So the setting up of the Central Epidemic Command Center, the CECC, is really the most important part. The CECC is a organization with a full authority as authorized by the Act that has been revised quite a bit after SARS. So that I think it was in January 20th where they started their daily press conferences. And every daily press conferences are live streamed. We work with the journalist community. The idea is that the press conference is not a one-sided conversation. It's basically ask me anything, so that the Minister of Health and Welfare answer all the questions from all the journalists until they run out of questions, and which is also live streamed. So because of this, whenever there is new ideas coming from the civil society, there was a phone line, still it is a phone line called 1922. People can just pick up their phone, call 1922, and tell the idea to the CECC, establishing a bidirectional connection between the civil society and the response system.
And has that yielded any ideas from civil society that have been implemented?
Well, for example, there was one day in April where a young boy said that they don't want to go to school because his schoolmates may laugh at him for wearing a pink medical mask. And the very next day, on the press conference, everybody in the CECC, including the Minister of Health and Welfare, started wearing pink medical mask, making sure that everybody learns about gender mainstreaming, which is also a social innovation. And so this kind of fast response builds trust between the government and the civil society, because people can feel that their ideas is being taken into account in a 24-hour cycle.
Mm-hmm. And tell me about the role that technology and software has played in your coronavirus response here.
So I think the main idea, the focus is fairness. For example, when we ramped up the facial mask production, making sure that everybody can use their national health insurance card to collect masks from nearby pharmacies. Not only do we publish the stock level of all the pharmacies as other countries with an FOIA would do, but we publish it every 3 minutes, which is very different. In most government bureaucracies, you publish at the end of the day because you want somebody looking at the numbers to make sure that it hasn't gone horribly wrong or wrong by orders of magnitude or things like that. But we connect directly the NHI, the National Health Insurance System, to open data. So everybody in the world has access to all the stock level, almost like a distributed ledger every 3 minutes. And so that's why GovZero and many community contributors built more than 130 tools that enable people who prefer view maps to view where are the nearest pharmacy that still have this medical mask in stock. People with blindness can look at the table or hear from the voice assistants, or people who are using only the end-to-end encrypted system called Line. It's like WhatsApp. There's also a bot that is very popular. All of them can get the same inclusive access to the information about which pharmacists near them still have the mask. And because Taiwan has more than 99.99% of health coverage, people who show any symptom will then be able to take the medical mask, go to a local clinic, knowing that they will get treated fairly without incurring any financial burden. So that enabled people to make the decisions that are pro-social out of kind of selfish reasons. This is the incentive design that technology has enabled.
And one of the key strategies which we've seen used over and over again in countries that have successfully managed to handle their outbreaks has been contact tracing. How did you go about doing that in Taiwan, and what role did technology play in that?
Yes, so the contact tracing technologies in Taiwan is based on classical contact tracing, interviews, and so on. But we put special care on the port control because we're basically a bunch of islands. There's no way to kind of accidentally stumble on Taiwan. You probably have to arrive through an airport or a seaport. And so at the port level, we make sure that people who return from a high-risk area, the entire plane, all the passengers, not the plane itself, goes into centralized quarantine. If it's coming from a lower risk place. People who show any symptom, of course, still gets quarantined and treated. The people without symptoms are still home quarantined in their homes. If they do not live in a home with plenty of room so that they can keep a social distance with other people, or if they live with vulnerable people, we also have staying places so that they can stay there for 14 days and get compensated about 33 US dollars a day for their effort, or 1,000 times that fine if they do escape the home quarantine.
Wow. And how has the population responded to this contact tracing?
Well, the population really insisted to play a kind of co-detective role. So there's a lot of people calling 1922 about the suspected cases, suspected symptoms, and things like that. We had to have to massively assign a lot of staff to answer those calls, to triage those tours, and so on. But it's really effective. And also, because of the digital fence is based on the idea that for the 14 days of the home quarantine, people who are attached to their phones anyway cannot move outside of the digital fence. Otherwise, a automatic SMS is sent to the local household managers and the police. Their neighbors also help enforcing essentially the digital fence for the 14 days and making sure that they get plenty of video calls like we do now to make sure that they're still around and also their mental health is being taken care of.
Right. And have there been any concerns about privacy and surveillance? Because I know that's an issue that's been raised here when we're talking about contact tracing apps and tracing people who may have the virus or may have had contact.
Yeah, we've not launched any contact tracing apps. There's no.
Sorry, I mean things like the digital fence. Has that raised any concerns about
It of
surveillance?
course is surveillance. It of course is a intrusion on human rights and privacy during those 14 days. But that is because we do have a constitutional ruling dating back from the SARS days. After we look at the barricading of the hospital, the Constitutional Court found that it is not unconstitutional, but if you can replace it with something better, something that is a fixed length of termination, and that has a fully informed process, and that is less intrusive than a physical barricade, then by all means use that instead of a physical barricade. And so because of the constitutional ruling, I think over 91% of people do approve of the CECC responses. And I'm not pretending the 9% who do not agree, that do not exist, but there is constitutional basis for this digital fence that we've been building.
Right. And I understand that you were able to merge citizen health data from insurance databases with immigration and customs information to kind of create this big data set. Could you talk a little bit more about that? Explain how that works.
Well, that was actually only in the early days, where there's still high-risk areas in the world and lower-risk areas in the world, as I just mentioned. But after a while, the CECC just decided that everywhere else on Earth is high risk. And so the immigration database is no longer very useful because we ban all the incoming flights anyway, other than returning citizens, and all of them go into home quarantine and so on. So it was a very early intervention that made its contributions in the early days, but it's not on our minds very much anymore.
Great. I just want to pause here and remind people that we are taking questions from the audience. I've seen a couple come in on the side here. So if anybody is watching out there and wants to send in a question for the Minister, you can do that on Twitter using the handle @AC_Scowcroft or in the comment section of Facebook and the YouTube live streams, whichever you're watching. And I'm going to turn now actually to a question which was sent in ahead of time from Tina Chung from Voice of America. And Tina has asked whether you could talk about the conflict between civil society and the government on privacy and transparency, about when would, about when each would need new information from the other side to effectively contain the spread of the virus. How are you kind of managing this conflict? Yes.
Okay. I do not quite understand that question, to be very honest with you. I understand it as, for example, people who are, for example, panic buying would think that the government is withholding information. For example, the tissue papers, when people went to panic buying tissue papers, there was a persistent rumor that says the medical mask is made out of the same material as tissue papers, and so we're going to run out of tissue paper soon. And everybody went panic buying, and the conflict was between the government who want to get the information through that it is actually not the same material at all, and we're not running out of tissue papers, and the civil society which think the government has something to hide. Is that kind of what you're understanding too?
I think, yeah, the question was a little bit unclear, but yeah, I think it was hitting on the point of civil society, government, and privacy and transparency.
Right. So yes, yeah. So in Taiwan, our counter disinformation strategy is based on this idea. It's called humor over rumor. Very easy to remember. So when there was this panic buying of tissue papers, as I mentioned, the premier, prime minister, essentially, was basically showing a very funny mimetic picture. That's our premier, Su Zhenchang, smiling happily, working with the convenience stores. You can see him here. And then he posted this on social media, which is his bottom, wiggling it a little bit actually, and says in very large font that we only have one pair of bottoms each. Meaning that we don't need to panic buy tissue papers. And then a very clear table that shows the materials of medical masks come from Taiwan, and the tissue paper material came from South America, and so on. So it's an informative infographic with a extremely funny mimetic packaging. And so this went absolutely viral. Because of that, the panic buying of tissue papers actually died down within a day or two. And finally, we found out the person who spread the rumor was a tissue paper reseller.
That's interesting. Have you seen any disinformation about the virus or about Taiwan's response to the virus coming from other countries?
Yeah, certainly. So there was persistent disinformation about Taiwan, for example, gets 0 cases because we do not do tests or things like that. Of course, it's not true. We do a lot of tests, and we're using RT-PCR predominantly as other jurisdictions. And the great thing in Taiwan is that when people question this kind of things, they are guaranteed to get a response. And education and epidemiology, really, with our CECC commander, the Minister of Health and Welfare, Chen Shizhong. And after he gives his lecture, all the journalists can ask questions. He always take on the role of a student also learning about this new epidemic because it was not SARS. It's not the same as SARS. This is actually much more complicated than SARS. So she always take a very humble attitude and say, we're all in this together. We need to learn from each other. And if you have anything that I have not thought of, please let me know and call 1922. And so that humble position basically increased the trust of the kind of lessons and lectures that he's getting. And also helps is the minister's spokesdog. So this is literally our social distancing meme. If you're outdoor, it's 2 dogs. If you're indoor, that's 3. And it's reminding you to not sneeze, I guess, with your mouth uncovered and so on. And so there's a lot of funny dog pictures wherever that the CECC daily press conference is done. It gets translated into the Doge CEO, the Songchai, quickly, including hand sanitation rules and pre-orders and so on. And that all go viral. So we make sure that our humor, our factual humor, spreads faster than rumor.
That's fantastic. And changing tack slightly a little bit, I've seen a lot of headlines in the past couple of weeks about Taiwan sending masks internationally to other countries. And a lot of people a lot of journalists have used the phrase mask diplomacy. And I'm wondering, given the very contrasting ways in which China and Taiwan have handled this, especially China in the early days, kind of covering up the outbreak, not being fully forthcoming about what was going on, Taiwan, on the other hand, sending shipments of masks internationally. How do you think this is going to change Taiwan's standing with, both with kind of major world players such as the United States, but also within international institutions like the World Health Organization?
Right, there's quite a few trending websites about Taiwan. There's taiwancanhelp.us or taiwancanhelp.us and taiwancanhelp.com.tw, which respectively tells from the civil society point of view the timeline as well as Taiwan's contributions. And the taiwancanhelp.com.tw says, like right now, that in the past couple of days, we collected 2,282,000 masks from more than 261,000 dedicators and so on. So it's basically saying that this is not just about first track diplomacy. This is not just about our diplomats making sure that the people in need internationally get supplies from Taiwan. This actually come from more than 200,000 in the past 2 days, no doubt more tomorrow, citizens who voluntarily signified that they want to dedicate their uncollected masks to the international community. So I think it would enhance not only the so-called first track diplomacy, but it also increase the people-to-people ties as well.
Mm-hmm. I think we had another question on that from sent in ahead from someone watching. We have a question from Manik Mehta from the Taipei Times. Thank you, Manik. Manik asks, would the World Health Organization, which has systematically denied Taiwan direct access to its expertise, benefit from Taiwan's handling of it?
Mm-hmm. Yes. Well, as I mentioned, we began health inspection for flight passengers flying from Wuhan the very first day of this year. And as of January 10th, I think, WHO did not recommend health inspection for flight passengers from Wuhan to its member countries. So had we have direct access to the ministers level through the WHO, the entire world will gain 10 precious days because of our early warning. We do have access to some of the scientific communities, but unless you happen to have like our vice president, literally the person who wrote the textbook on epidemiology, who are both a scientist and also our vice president, the scientific access is not the same as ministerial access.
Mm-hmm. I understand. And if anybody wants to send in questions, I would encourage you to do so. We have further 15 minutes of the minister's time. So please, if you're on Facebook or YouTube, send it in the comments below. Or if you're on Twitter, send in your questions using the handle @AC_Scowcroft. So I'm going to go to another audience question now. It doesn't say who the name is, but thank you for sending it in. The person asks, is there any direct communication between mainland China, whether with Fujian authorities and medical professionals or Beijing, to coordinate the COVID-19 response?
Mm-hmm. Yeah, there were 2 experts from Taiwan that visited Wuhan on January the 12th to gather the information on the outbreak and control measures implemented in Wuhan. So that's well documented. But other than that, I'm not aware of any direct communications.
Interesting. And so we have another question this time on vaccines. And somebody's asking, could you please tell us what is the progress regarding the process of vaccination making in Taiwan and whether there are any clinical trials?
Mm-hmm. Yeah, we managed quite early to isolate virus strains from patients to synthesize the spike protein, a key material in vaccine development. But I'm not the vice president, Chen Jianren, so I cannot comment too much on vaccines. Suffice it to say that we really want vaccines because currently we rely on the physical vaccine, that is the medical mask, but we all understand that it doesn't scale to the entire world. Only vaccines scale to the entire world. There's more and more medical masks being produced, and we're also offering the medical mask voluntarily, as well as kind of teaching other countries how to make the machine that make those medical masks. But at the end of the day, it still takes a vaccine to completely end an epidemic. So we are committing a lot of resource on it. If you're interested in what you can contribute, there is a website called cohack.tw that anybody from any place of the world can look at the 6 pillars of responses and see how the digital community can help as well. The people who are doing vaccine research or people who are doing the frontline responses and nurses as well, very important.
And what was that website again, just in case people are interested?
So it's cohack.tw, COHACK. So like a hack, and then co as in collaboration, but also as in coronavirus.
Right. And we have a question from Mieon O with the Scowcroft Center at the Atlantic Council. She asks, how can Taiwan strengthen cooperation with the US and its allies and partners during this crisis?
Mm-hmm. Yeah, we just had a virtual GCTF, the Global Cooperation and Training Framework, this morning, Taipei time, last night, your time. And the GCTF, which is a kind of small minilateral is always hosted by Japan, by the US, and by Taiwan in a way that shares our common concerns and our common strengths. And we invite like the fourth or the fifth host countries based on the topic. And so this morning's virtual GCTF was precisely how we can pool our resources to combat disinformation on COVID-19, on how to counter the infodemic, so that people learn about good scientific facts instead of just rumors and conspiracy theories. For example, the founder of PTT, that equivalent of Reddit, is currently running a nonprofit called AI Labs, and he shared using sentiment analysis and text mining how people's sentiment toward each other are, so that we can make sure that when we're sending our messages, we hit the right emotional tone, and we actually allow a lot of remixes using Creative Commons, so that people can really remix the memes so that it become more precise toward the target audiences that they want to inform. For example, the proper hand sanitation rules. There's very easy to remember lyrics like 内外加工大力 one that tells you how to wash your hands properly and things like that. So there's a lot of creativity and innovation across the board in the US, Taiwan, and now Japan co-created GCTF forums.
That's interesting. I mean, what has been the role of citizen hackers in this? I feel like you've mentioned that a lot. Not hackers is not the right word, but citizen developers.
Yes, civic hackers. We used to call the technologies that the civic hackers make civic tech, meaning that everybody can participate. But this is the first time that they think that they're actually civil engineers, as in the pharmacy mask map that they produce is used by over half of population, making it as much a infrastructure as roads and bridges. And so they're both civic tech technologies in the sense that everybody can participate in an open fashion, but also civil engineers in the sense that everybody is making the full use of the code that they produce. And so I think it's important not only as a data publishing tool, but also an analysis as well. There are people who make very professional dashboard that lets people see that first our supply is indeed growing, and also shows where in Taiwan do we have an oversupply or undersupply, so that we can change the strategy with the pharmacies. And there's several pharmacies that are also coders, so that they can propose changes. And the received supplies, as well as the ordering system and so on, are all co-created with a whole of society approach.
And where does the funding come from when these apps are initially developed by citizens and not by the government?
Yeah, the very first map made by Howard Wu in Wujianwei is using the Google Place API. And within just a couple short days, there's a very large amount, like 20K US dollars of usage fees. And because of the use of the map API, so that he could not continue running it out of his personal budget. And so the National Center of High-Speed Computation at the moment is supplying most of the bandwidth of the Civic Hacker project. It's a publicly funded, I think, the world's 20th fastest supercomputer and running on a very high-speed internet connection. And I still also want to thank Google for waiving the initial fees of that initial prototype.
We have another audience from the question from, I'm sorry if I'm going to pronounce your name wrong, Nieves Perez. Is Taiwan helping small countries around the world? And if so, what type of cooperation or help are they giving?
Right. So the most, the simplest is the medical mask, right? We've made many donations, dozens of millions to countries suffering from the pandemic, and also especially for medical workers. And there's also personal protective equipment to Italy, ventilators to Prague, and many other countries as well. And so I think the main thing that we can share aside from those medical supplies is the Taiwan model. Like, how do this whole of society communication happens? Where do we do this incentive design, which is very interesting about the mask being built as something that protects you, because it reminds you not to touch your mouth with unwashed hands, it reminds you to wash your hands properly, while it actually protects others. And so there's a social norm that even just a few people wearing masks in a large crowd can basically recommend other people to take care of themselves and to grow a mask culture from there. And that is the kind of social incentive design that I'm also very happy to share with fellow citizens from across the world.
And we have another question from Darby Sinclair, who says, first of all, many congratulations to Taiwan for 4 days of zero cases. Has it been 4 days or is it even longer?
It's even longer for domestic cases, but there
Right.
was a Navy ship. So that counts as part of the territory, I guess, but not a part of the domestic island. So depending on how you count. But yeah, even including the Navy, it's been 4 consecutive days.
Great. Anyway, back to Darby's question. They're asking, what is the long-term approach for Taiwan to begin to reopen the country?
Yeah. So actually, we're very open now. Our schools are all open. So I'm not quite sure what else to open. I guess the main thing being discussed right now is to resume business flights. That's for
Right.
sure.
Right.
Flight.
Did you ever have a full shutdown like we've seen in the US and Europe? No.
No, we've always been operating under normal legal system. We've not declared emergency situation. And because of that, many technological solutions in other jurisdictions that has invoked the emergency clauses in their constitutions so that the administration can do whatever and the legislation approves it afterwards. We've not had that. Everything that we do need a legislature approval, which makes sure that all we do is constitutional within the normal law, not the emergency law. And that puts some constraints, of course, on the responses that we can do. But there's also a special act that says that there's if there's necessary measures administratively that doesn't run afoul of other acts, the Central CECC commander may also give orders to that effect. But there's not been a lot of orders. There's only, I think, there was the most recent controversial one, I think, was the closure, like not open for business. The places with drinks and dances that people pay not for those drinks and performances, but rather for the intimate escorts. And so those were closed down because there's no feasible way to maintain social distance in such businesses. But other than that, everything like karaoke or whatever still remains open.
So they're open, but they have to implement social distancing. Is that?
That's right. And if there's no conceivable way to implement social distancing, that's the narrow case where it got closed. Of course, there's like restaurants that invents like transparent curtains between the tables, like everywhere else. But by and large, people are feeling calm and collected, and they still go to work, go to business, go to school as normal.
That's fantastic. And so, what advice do you have from your experience in Taiwan for policymakers, the local and national level, elsewhere in the world, when they're now looking to go ahead and reopen their economies? What needs to be done to contain further outbreaks?
Yeah, first of all, I think this whole of society approach really need to be emphasized because it is not our vice president or our vice premier who is a student of our vice president on public health, nor is our minister's order that keeps Taiwan safe. It is the people who voluntarily actually reminded each other. So, for example, our social distancing rule is actually keep 1.5 meters from each other indoors or wear a mask. But people do a social distancing and wear a mask. So they overdo what the social distancing orders are, recommendations are. And the interesting thing in this is because the people feel that the government is too lax, and people need to remind each other to keep each other safe. And just keep each other safe and learning together from each other. Even our vice president made a MOOC, a massive online open course on epidemiology 101, teaching R0 and everything to people. And it's been a hit. It's promoted by a lot of the very popular YouTubers in Taiwan. So just treating each other as co-learners in this, making sure that we learn together the science and the art and the memes that keeps everybody safe. I think that is the most important message.
It sounds like trust has played a big role, though, in Taiwan's ability to respond.
Yeah, the government need to fully trust its citizens.
Yes, yeah, and vice versa. I mean, the citizens trust in the government as well.
Well, 91% do, but yes.
I mean, that 9% that don't, what are their reservations about the
Yeah.
response?
So first of all, some of them worry that these norms will become part of the culture. That because of the vaccines, there may be a delay. We may have to live a year or so with such norms. And just like counterterrorism norms, sometimes the society living through those norms do not revert back to the old normal. It is quite a privilege in Taiwan to have people who worry about these things because there are a lot of places where there is no other resort than total lockdown, which of course infringes the privacies and the social freedoms even more. But they do keep us honest. They do ask for accounts for everything that we do because it's under normal law and not emergency law. So I also think those 9% that keeps us honest and accountable.
That's great. Well, we are just about to hit our 9:45 a.m. for us at the very least out time. So I will leave it here. I know you're busy and you have a lot on your plate. Just thank you so much for joining us. I mean, do you want to offer any closing remarks before I sign us out?
No, but feel free to read more at taiwancanhelp.us. And thank you for listening.
Thank you very much for joining us. You take care.
Bye.
Thanks.